Good afternoon, everyone, and welcome. Thank you for joining us for today's important webinar on arts-based activism for health equity. My name is Andrew Anderson. I'm honored to serve as your moderator for today. I'm also an assistant professor in the Department of Health Policy and Management at the Johns Hopkins School of Public Health and an associate director for Partners for Advancing Health Equity, or P4HE for short. Our Research Learning Collaborative is based at the Tulane School of Public Health and Tropical Medicine, and it's supported by funds from the Robert Wood Johnson Foundation. At P4HE, our mission is to foster collaboration across a variety of sectors, which includes government, academia, community-based organizations, philanthropy, the private sector, among many others. Our goal is to deepen our collective understanding of the critical challenges at the intersection of health equity, health and equity. And one of the ways we achieve this is by creating platforms for meaningful dialogue and action. We organize activities that facilitate insightful conversations on pressing issues and encourage the development of practical and actionable solutions. Art, in its many forms, serves as a potent catalyst for social change. It reaches beyond mere communication, touching hearts and inspiring minds. By harnessing the emotive power of art, we can shine a light on community voices and emphasize critical health issues, moving us closer to achieving health equity. Today's webinar exemplifies this approach by uniting diverse perspectives from the arts, activism, and various professional sectors. Our speakers will explore how art can serve as a powerful tool for activism. They will discuss innovative ways that organizations from different sectors can partner with artists to engage communities, mobilize support, and drive transformative change. For instance, street art has been used globally to address issues of mental health stigma, with murals in cities like London and New York, providing not just beautification, but also public messages of support and awareness. Performance art, too, has made significant impacts, such as the Theater of the Oppressed, which empowers communities to enact real-life challenges and explore solutions through interactive drama. Through today's discussions, we aim to uncover how these creative collaborations can effectively promote health equity and spur societal progress. But first, we want to hear from, before we hear from our panel, we want to hear from you. And we know that you all have valuable opinions and insights on health equity, and we want those to drive today's conversation. So we'll be using Mentimeter, which you can see on your screen here. You can scan the QR code using your phone camera, or you can go to menti.com on your browser or mobile device and enter the code you see displayed on the screen. And we'll take a moment for you all to log into this, and you should see a question popping up on your screen shortly. Okay. So the question is, how do you think the arts can play a role in advancing health equity? And I'll give you a few moments to respond. First reactions, maybe even some examples from your work or work that you've seen. Examples of different initiatives over the years in different social movements. Okay, raising awareness of challenges and solutions. Definitely. As I just brought up that example of mental health stigma, we see art in a lot of spaces. Oh, great. Lots of responses coming in. Art can express things that words can't. Absolutely. It's a way to appeal to other forms of knowing and our emotions, our empathy, building empathy and compassion. Yes, definitely. Bringing awareness about issues or a problem. Yes. Allowing folks to express themselves without words. Absolutely. Performance art, lots of different arts, open to dialogue. They spark parts of our creative minds that allow innovative approaches, some that may not be heard of yet. Yes, apps. Telling underrepresented people's stories and experiences, yes. Creating stronger connections with others, right? Even through the collaborative experience of making art. We're moving around a little bit. Increase opportunities for out-of-the-box thinking, play, Play is important in imagination. We need imagination in order to come up with solutions. It can approach health where words cannot go, evoke emotions, and might even address stigmas where words might be too harsh. I love that. Art can improve science communication too, absolutely. When we think of visualization, even being able to even just visually conceptualize ideas. Intentional art education creates a more holistic educational experience. Yes, it's accessible. Yeah, absolutely. The common ways that inequity manifests in healthcare. Yeah, yeah. A lot of people are visual. I even think about the advent of photography and journalism, and just being able to see a lot of what people are experiencing completely transformed the way people think about social issues. And art goes beyond that. Um, great, awesome. Thank you for that. Those were really thoughtful responses. So we're really excited to have you here collaborating with us. We want you to continue to share your thoughts and comments throughout today's webinar. You can also just join this conversation with your questions and comments beyond this webinar. You can use our Twitter handle, which is #partners4, the number 4AG. You can also drop in your questions here during Q&A. So in the interest of time, though, we're going to move on to the panel discussion featuring our distinguished guests. I'll be calling on each one of them one at a time to introduce themselves. I'm going to ask them, or ask the starter question to all of the panelists. I would like them to share an experience or project that highlights, how and when they first realized the power of art in driving social change and health equity. So the first panelist I will call on is LeConte Bill, who's an associate professor at Michigan State University.
Hi, Andrew. Thank you for this opportunity. My titles are in the introduction and on the flyers, so I just want to briefly introduce myself in one of my languages, which is poetry. I come from the bottom of Nana's pocketbook, in the corner of Papa's cigar box, the satin in Mom's head wraps, and the spiral in Dad's notebooks. I come from an Oldsmobile hoopty creeping down the 110 freeway. I come from playing teacher after a full day of school and homework till the streetlights come on. I come from students hungry to see me. I mean, happy to see themselves in me. I mean, hurrying to be in a classroom with me. And would you like me to respond to the question about, I guess, the first?
Yeah, thank you for that. Yes, yeah.
So I think one of the first ways that I saw that art can inspire or affect health equity is me rolling around in that hoopty on the 110 freeway with my mom growing up in South LA, and her trying to find free and accessible art made by and for Black people, and me seeing that art and those artists really depict the what we now know as structural and social determinants of health, but also not discount the opportunities for healing and for justice. Thank you.
And our next panelist, Joy Williams, who's the founder and executive director of Hope to Thrive. Joy.
That was a beautiful introduction. So thank you for that poetry. I was snapping in the comments. For myself, I am based in Winston-Salem, North Carolina. As Amy mentioned, I am the founder and executive director of Hope to Thrive, which is a nonprofit that really strives to do immediate addressing of health concerns, and then also bring hope through different future programming. So one of the programs is African dance that we've done with youth here in the community. And I think for myself, when I realized that arts could be used for social change, was the impact that dance had on me as a child, and being able to express, and it interrupted my season of depression, and it was a place where I found a beautiful home in a sacred place for me. So I would say around middle school was when I discovered art as the ability to change individuals.
Wonderful. Thank you for sharing. And then our next panelist, Avis Gray, who's a health equity leader at the Ashe Center.
Good afternoon. My name is Avis Gray, and I'm a leader of health equity at Ashe's Cultural Arts Center. I am the leader of a group of culture bearers and artists who are, our program is called I Deserve It. And we use culture bearers and artists to do messaging, wellness messaging in communities. When I first really looked at art as activism, it started with a song that my mother told me about and played for me, which was Strange Fruit by Billie Holiday. It definitely shows that we as a people go back as centuries. Our music, our dance has always been art as activism. And that's when I knew, when I would look at, I know how the cage birds sing. It's so much in our history. But the recent programs is that this program came out of looking at COVID and how we used art, how we used song. The government was very concerned because we were all at a level playing field then. We were all getting COVID. And so people of color were just not listening to the messages because they don't trust government. It really showed how they reached out to art. They reached out to the culture to get the message across that this was a real pandemic and to get to our communities. So our history of dance and song and spoken word being part of our activism and how we use that in this pandemic is, to me, a history of, and up till today, that art is used as activism.
Thank you. And then last but certainly not least, Jasmine Blanks, who's an executive director for the Center for Social Concern at Johns Hopkins University. Jasmine.
Good afternoon. It's good to see you in this space, Andrew, and to see the audience. I am I'm a mom. That's the first way I identify myself these days. I have 3 little ones, an infant at that. She's 8 months old. And I am an artist and activist. Those are the ways I've always known myself. I think one of my earliest memories, since that was the question, was actually learning about community change through Girl Scouts. And I grew up in Philadelphia, and my Girl Scout troop was all Black little girls. And the one thing that I will always remember about that troop, and I started when I was about 5 years old, I was a daisy, so not even a full Girl Scout, was that they taught us African dance, but because only one person had actually been trained in any part of West Africa, the dance that they taught us was the choreography from Coming to America. So to just think about how the arts are often used to create spaces of belonging, of reciprocity, of trust, of community support, and in the space of an organization like the Girl Scouts, which are known for being these organizations that are about civic engagement and like political understanding and growth, to have a meeting point of racial socialization and community change that was really birthed out of having really rich arts experiences for young Black girls in Philadelphia was really formative for me. And I'm excited to continue to talk about how that fed my work as a theater practitioner and nonprofit founder, and now my role as the executive director for the Center for Social Concern at Johns Hopkins here in Baltimore.
Wonderful. Thank you. All right. Thanks for those amazing introductions. And I hope everyone else feels like they know you a little better now. So the first question that I'm going to direct this one to Joy, and you started in your opening remarks to speak to this, but Joy, if you could talk a little bit about how you view art as inspiring change, and just generally the role of art and activism.
Yes, as I was thinking about just this whole webinar, I just have to take a step back and just look at us as humans first and the role art plays in just humanity. And then like even looking at art as something separate than the human experience. I think throughout time, we need art, we need creativity, we need to be able to express ourselves, whether it's through song or movement or visually. I think a lot of people think that art is about those people when really it's about our human experience, whether we choose the colors of how we dress, of our clothing, or how we decorate our homes. Art, as we know it as art, as the separate experience, is really an experience of us as humans. And it inspires us to be happier. It inspires us to cry, or it inspires us to emote in whatever way that we need to, whether it's theater, watching a movie, or watching a play. And it just tugs at that experience, that level of empathy. And so when we talk about art being able to inspire change for health equity, humans run systems. And when art or an experience and creativity can change us as humans, and we as humans are driving the systems, we then get the opportunity to change something, whether it's our personal health, our community health, or whatever power lies within our hands. So hopefully that addresses briefly how I consider art playing a role in health equity and the change that it can help inspire.
That's wonderful. That your comments made me think of two words like transcendence and numinous, and that, you know, when religion in some instances helps us touch that sphere, which is common to all human. And I feel like art, and especially the way that you described, you know, helps us reach into that, whatever that is, that, you know, so that's really wonderful. The next question, just which is related, you know, what types of information or messages, so this is to Avis, do you think, you know, are best conveyed or can be conveyed through arts-based activism for, you know, specifically looking at the intersection of health and equity?
The program that we're doing right now, I Deserve It, has a wellness manifesto. One thing about art, it makes you feel deeper. It makes you challenge conceptions about things. And so we have a manifesto that goes into proclaiming. I proclaim that we have a right to live long lives, safe neighborhoods, affordable, accessible healthcare, quality housing, food, and healthcare. So it takes where we take poetry and we have the messaging that looks at how within our culture, while we respect our culture and art, that we put messages about wellness, holistic wellness. How do we have messaging about we have a right to these social determinants of health, or whatever the government wants to call it. But these are rights because of who I am. I am, because of who I am right now, deserving of. And so how do we take this and put it into a spoken word? How do we take these messages and put them into something like a wellness manifesto, where the whole concept is I deserve it? How do we put that into a play? How do we put that into a song? How do we take our Mardi Gras Indians and our baby dolls and all of the things that are our culture, and we make sure that those messages are given out by trusted messengers, that you have the right to all of these things in life, that because you are who you are, because of, look at our ancestral history, and we even bring in the ancestral component of it. We come from kings and queens, but we put this into different modalities of art. And we get that message across that puts us in a place that we remember who we are. And we pass this on from our ancestors to where we are now to our children. So this concept of I deserve it, and using art and using culture to put out messages about economics, about education, about holistically what you deserve, and to get us in that mindset and make us look decent, deeper, and also using these non-traditional avenues, because we see historically that what has been utilized has not worked. We have a 25-year health disparity between people of color and white people in our city. It is so important that we understand that no matter where we live in this city, we deserve all of these things that life have to offer.
Wonderfully put. Thank you for that. This is naturally leads to just a general conversation to talk through some of those examples. You know, you mentioned one of your projects, but maybe LeConte, if you'd want to be the first to speak up on maybe some examples of arts-based activism in your work.
Sure. So I think from a public health methodological standpoint, many folks on the call might be familiar with photo voice and video voice. And again, these are technologies that remind everyday folks that they too are artists and they too are public health practitioners and activists. But I also think about other types of art that aren't always taken up in the public health sector, but that I see do contribute to health and public health. I'm thinking of in New Orleans, B Mike and Studio B. So visual art and seeing art as social practice, and where people can come and participate and experience art, but also see how it relates to their everyday lives, but also to health inequities and to justice. I'm thinking about Anna DeVere Smith and her One Woman Plays, where she tackles many issues. She's talked about urban uprisings, but she's also talked about inequities in the healthcare system with her play Let Me Down Easy. In my own work, I've used poetry, particularly with young people around the country, to unpack issues around gentrification and urban renewal and foreclosures, but also to situate young people as co-scholars and co-activists. And the great thing about those projects, which came from my dissertation but have flourished in the decades since, is that art as activism doesn't just live with me as a scholar or me as an adult, that the young people who have created and produced that art can take that art and publish it themselves, they can perform it themselves, they can advocate for it, and they've been invited. Particularly, I'm thinking about the first group of young people that I work with my dissertation in East Oakland, shout out the East Oakland Youth Development Center, that with and without me were invited to City Hall and state governments and to conferences like APHA.
Nice, you covered a lot of ground there, that's great. And talk to some of the methods that you can use for arts-based activism. Jasmine, did you want to chime in a little bit maybe on some of your work here?
Certainly. And it was great hearing LeConte's overview. It reminded me of a conference that we actually just held with Hopkins last year, the RACE conference, Reparative Arts and Community Engagement. And LeConte reminded me of this because Dr. Antoine Johnson was a collaborator, and his work is on music and HIV and AIDS, also in California. He's done tremendous work around these issues there, looking at how music can essentially serve as a repository for the struggles that a community has experienced, from physical to mental health. But we worked together on the Reparative Arts and Community Engagement Conference, and I just want to share a bit about the purpose of what the conference was about. And I'll share from there. The RACE conference was designed, it understands reparative arts as processes. So the way LeConte shared, it could be methodologies, can be pedagogies, and or products, visual, audio, performance, that's designed to present a call to action for change to systemic and or structural causes of inequity and justice in our society by amplifying community solutions towards repair and healing. In medicine and public health, reparative arts can help memorialize victims of medical racism, such as Henrietta Lacks in the case of Baltimore. And we've seen a lot of monumental work that's been done recently. The Great National Blacks and Wax Museum is actually working on a figure of Henrietta Lacks within their museum. The students that I teach in my classes have created performance-based work for many of the figures in the Blacks and Wax Museum that draw upon the research that they found about Black historical figures. Some, like Henrietta Lacks, who their public health stories are known. Others, such as George Washington Carver, who we don't often stop and think about the many public health contributions of understanding just how useful a peanut could be, but what has been the African-American contribution to public health. And how do we utilize methodologies and pedagogies in the arts to lift those narratives? So I've had students create podcasts, students create monologues and short scripts, 20-minute long performances that help us understand even how maybe Zora Neale Hurston's research and work as an anthropologist in Florida helped us understand about using plants and herbs medicinally, how Harriet Tubman was a nurse, a spy, and a cook, and that we often miss opportunities to think about the really rich contributions of many people to public health. Personally, in my own work in Liberia, West Africa, with young people there, the first year that I went to implement the program that became B4 Youth Theater, which is burning barriers, building bridges, I went to meet the young people that lived at an orphanage that I was asked to come support. And I said, all I can offer you is some arts things that I do as a teacher. I was a music teacher at that time, and I had a lot of background in theater. And the young people, they said they wanted to write a play. So we created a play, and their main messaging was that if girls were supported to have more schooling that was free and compulsory, in 2010, school was only free and compulsory through grade 7 in Liberia because they had a 14-year-long civil war. The students argued, using an academic term, right? They created an argument through their performance that if girls could be supported to be in school longer, that it would be a buffer not for just enhancing their educational experience, but for keeping them healthier. If parents had to choose which child to send to school, the girl or the boy, they were going to choose the boy because the boy would have to be a provider, which would mean that a girl who wanted to stay in school would need to find other means. And that other means was often a boyfriend who was significantly older, and she would then be exposed to potential pregnancies or STDs or so on and so forth, and her chances of education and advancement in life would be cut short. So they turned this into a play with music and with dance, and they performed it for roughly 300 something people in the capital of Liberia, Monrovia. And the president at that time, former President Ellen Johnson Sirleaf, came to see that play and brought her entourage. And once the media picked up on that she was coming, it packed the hall, and people were there to hear what the children had to say. The government already had been working on a policy that would extend school being free and public through grade 9, but it was having that very public moment that supported a change in policy that allowed it to come into fruition. So the very next year, schooling was extended to be free and compulsory through grade 9. And it was an artistic moment led by community people, by community young people. We're talking about children as young as 10 years old up to roughly age 18, who created this work and who gave voice to themselves and to their communities and made a very real change. So there are many examples, but that is one that I will never forget.
That is awesome. That is such a wonderful, concrete example, and congratulations on helping to make that happen. That's
Thank you, the kids.
Yeah. Yeah. Related to local and community-based activism around art, I wanted to turn it back to Avis. If you could talk a little bit about the role of local artists and activists in using their art for advancing health equity.
Prime example is some programs that we have going on now. One is Equity Toolkit, where we're collaborating with the hospital system, where we're looking at using culture bearers and artists. They're part of a system of getting our clients that are discharged from hospital systems into social determinants of health, looking at all of their needs because they are trusted. So we're looking at them. And so the equity toolkit that we're developing is to meet with healthcare providers, to really meet with them in an artistic way in our presentation, to help healthcare providers have a better understanding of how to interact with community and clients around healthcare and referrals into primary care. My background is a nurse. I'm a nurse. Worked in the urban hospital systems, charity hospital system. I've worked in public health. And so looking at some of these non-traditional access points have been really good. Another program we have is using storytelling and lived experiences to impact policy. So we're using artists to really help us with looking at how do we get our communities to have that voice. We're looking at some legislation that we want to do. And we're using, once again, artists and art to really get those messages out there. The other thing we're using is musicians who are working with youth mentoring programs, where we have brass band members, musicians that are meeting with youth and working with them to look at, we have a high rate of adolescent violence in the city. So how do we start to work in schools and working with youth, using our musicians, using our artistry to really develop programs around access to healthcare, programs around mentoring programs. We have another one that's called Immunity in the Community, where we have one of our well-known poetess who are working with community, looking at ancestral medicine, looking at how do we build our immunity, healthy eating, all of that kind of thing. And then another one called Second Line for the Heart Line, where we're doing monitoring of what impact does this dance have on cardiovascular health. So there's some and also working with non-traditional sites, looking where the musicians are playing. Another big program we have is Narcan distribution for musicians. We have a problem in our communities with addictive disorders. And so we reach out to our musicians where they are in the community, and we do that messaging, looking at fentanyl and what impact that has. So really looking at how we use our artistry and our messaging and developing songs, looking at the maternal, African-American maternal deaths. And so how do we do programs? We've developed songs around that. We've developed plays around that. So looking at what those major issues are in our communities and how do we use art to really go to non-traditional places, develop song, develop drama, work with partners in behavioral health and addictive disorders and hospital systems and public health to really get those messages out, using our culture, using our artistry, and then trying to develop systems where we look at qualitative data. You know, how do we look at this from more than just a quantitative number, but how do we look at those stories? How do we look at those lived experiences? And then how do we use that to impact policy? How do we use that to go and make some legislative changes? So that's just some of the ways in which our program is really looking at trying to connect and do things at a different way, but also how do we measure it, the effectiveness of it, so we can make sure that we're not just saying that we feel like these non-traditional measures are making a difference, but that we can truly look at qualitative means to be able to measure this and develop programs that really impact and make a difference in our communities.
Throughout some of your comments, you mentioned you know, access to care and you know, art playing a role in connecting people even to healthcare services. And we know that, you know, a big part of especially health disparities is problems with access to care, problems with trust in local providers, and you know, just sometimes not even having health insurance or adequate health insurance, underinsurance. I was going to call on Joy next, if you would speak a little bit to how you think about, you know, art bridging the gaps in access to quality healthcare services among minority, historically marginalized communities.
I think it could be a twofold impact. One on the artist end, and then also on the receiving end. On the artist end, I think just being able to fund more arts-based messaging, whether it's coming from activists or community members or organizations where we're funding poetry and dance, visual arts. And I think with that, it could possibly even impact younger generations in the educational system where arts has been removed from the schooling and it hasn't been a focus. Nowadays, in order to see, I mean, you can go to museums that are free, but then there's also a lot of art that you have to pay for in order to have access to. So I think on just a basic level, if the grant-making world would spend more monies into art-based messaging, that in and of itself can give individuals in marginalized communities who are artists the collateral or the money or the resources, perhaps depending on the funding level, to be able to choose who their provider is. One of the barriers to access within marginalized communities is that a lot of people within those communities, they're told who they have to see. So whether it's from a free clinic or even if you have Medicaid, or even Medicare, there's only certain providers who will accept some of those payment services. And so you are limited to your version of what a quality healthcare service may be, and that could impact your utilization of the service. Because if you don't like your provider and you have to see that person, then it's like, why go? We fight, or they don't listen to me. I'm not heard. Like, what's the point? So I think just having reasons in order to make a personal decision about who is partnering with you in your health through the funding model of art-based messaging for those artists is one way that it can bridge a gap. And I think that's just an example on the artist end of this twofold model that I'm suggesting. And then also on the receiving end, I think being able to have more messaging emphasized, like through TikTok or through YouTube. We see examples every day of how those videos, whether it's dancing or a challenge, is impacting our youth, whether they're stealing Kias or whether they're doing ice bucket challenges or whether they're doing like whatever it is. People are influenced by social media and the arts that are transcended and displayed through those channels. And so what is to say that we can't use that same medium, but to say, hey, know your HIV status. Here's the ice bucket challenge to know your, like whatever it may be for the challenge. Like, are you taking your insulin or diabetes or whatever the health thing may be? I think those are some examples of how art-based initiatives and messaging, and whether we call it activism or just a PSA or whatever we may call it, arts can certainly be a useful tool in bridging the gaps to the access of quality healthcare services, in my opinion.
No, absolutely. Something that you brought up, with the, access to care varying by, insurance type, even like you mentioned, there's a lot of other kind of issues too with disability status. Like some people have issues with, the accommodations in their provider's office, the examination table isn't high enough, or, there's issues with, I say even in New Orleans, getting access to PrEP without having to go to a specialist rather than, even though it's considered primary care. I'm just curious, if you had any comments, and then I'm going to turn it over to LaConte next, actually, just to, thinking about how, art can serve at the intersection of all these different identities. It's if there's a unique role, and it sounds like some of what you were saying too is that because of the number of mediums, that art can be delivered in, that it can serve this role. But just curious if you have thoughts on that question, and then LaConte, if you wanted to jump in.
Sure, I think, and let me just make sure I'm understanding. You're wanting to know my thoughts about the intersection of different marginalized identities and how art can help. Yeah, I do. I don't necessarily think it would be from the individual, although it could. Like, I think a patient, if I were a patient and I would go into my doctor's, and this is a true story, my provider, and I wanted to change providers and I couldn't, I would have loved to have sing a song, why I didn't want to be with that provider like that. That would have been lovely. However, that did not occur to me to do in that moment. But at a separate conversation that I had with the directors of, who was paying for my my medical services, in talking with them, they were able to hear and then translate that messaging to the provider and to other people. So I do think that while the individual may not have the capacity in the moment to display some type of art to make the change happen, art certainly can happen on a systemic level, whether there's someone going to see a show or seeing a billboard and being impacted, like, I never considered it that way. Because as I was sharing with the director, she then reflected like, oh, you know what? I actually don't like my provider either, and I should probably change. Like, it was just, it was a moment of empathy, and also things that we have already shared, and of truth telling, and also being able to say, yes, this is a problem. I feel like intersections of different identities within marginalized communities, art can be that voice, whether it's literally a voice, whether that voice is doing poetry or singing, or that voice is in the form of a dance. It can certainly help bring attention to where the other parts of us as humans, whether we rely on just the math part or the data, or just like our basic communication of transaction, where those things are limited, art can certainly break those barriers to say, hey, this is about you too. It's not just about my own experience. And I think that's what makes art so effective. It brings the we into what started as a me problem.
Mhm. Mhm. Thank you for that. Yeah. And what are your thoughts here, LeConte?
Yeah, I love, this is a perfect segue from the me to we. I have two examples. I lived in Brooklyn for 8 years. And during that time in 2014, the artist and activist Simone Lee created an art intervention, an art and activist intervention called the Free People's Medical Clinic. And she was evoking the Black Panther Party's free breakfast program and Free People's Medical Clinic testing for sickle cell at the time, but also evoking the United Order of Tents, the secret society of Black nurses. And in the 2014 intervention, she took over a former mansion in Bed-Stuy, Brooklyn, and basically created free and accessible health services that really spoke to the diversities of marginalized people and people of color. And so she had yoga teachers and dance teachers and herbalists and other healers, but also people that can help people navigate health insurance and patient navigators. And it was really an opportunity to be in community, in an urban space, but also evoke, again, the history, but bring it to the future. There was zine making to kind of document what was going on, but also making of mixtapes. So thinking about how we document our interventions and our practices, thinking about how we bring the history and the future to the present, and thinking how our movement, literally somatic embodied movement, is part of the movement. And then another example that comes to mind is more recent, and some people on the call might have seen this in person. I can't wait to go, but the Mothers of Gynecology Monument in Montgomery, where artist and activist Michelle Broder has taken over one of the former sites where Dr. J. Marion Sims, without consent, experimented on Black girls and women. We know just a few of the names like Betsy, Lucy, and Arnaka. And sometimes when we say those names, we say Black women, but many of them were Black girls, right? And so I've found out more about those atrocities through poetry, like the poetry of Bettina Judd, the poetry of Dominique Christina, but also this monument literally creates a monument of these women, of their displaced wombs, in the figures, the beautiful figures of Black women. And it's a health intervention to witness it, to grieve, to mourn, but also to think about the beauty that can come from our continued activism.
Wonderful example. In a related, I think I'm going to ask this question to you too, LeConte, first, and then I wanted to bring Jasmine into the conversation. There's often a disconnect between, public perception of health disparities and the issues that marginalized communities face and the reality of it. So I'm curious some of your thoughts on, how art-based activism can sort of change or influence public perception.
I'm thinking of the various publics that we have. I know sometimes when we say public or we say community, we, say it as if it's a monolith, but there's different kind of public. So the first public that I'm gonna think about how I and others are working to shift are academic publishers, academic editors, other scholars. My comrade and co-conspirator, Dr. Shanae Birch, I saw is in the Zoom space, and together with Dr. Ryan Pettaway, we are the inaugural co-associate editors of the Poetry for Public Health section of the journal Health Promotion Practice. And with that, we are editing and publishing poetry that is peer-reviewed, that has a DOI number, and that is considered scholarship, right? So really working to decolonize and disrupt what we think about peer review, what we think about publishing, what we think about scholarship. We know as artist scholars that this is always teaching, this is always disruptive, this is always creating and liberatory. And then another public, I think I also want to call in academia. And so at Michigan State University, there is a fellowship called the Transforming Theater Fellows that trains students across the university. So students that are not in theater or drama as a major concentration, but across disciplines to actually take a year to learn playwriting. And with those plays, the plays are all about the intersectional oppressions that go on at universities, the types of racism and sexism and ableism and other atrocities that students experience while students are asked to still show up and show out in the classroom. And these plays, the Transforming Theater Fellowship is actually housed in our university's DEI office. And so the plays, you know, call out these atrocities on campus, often enacted by academics, but also being situated in the DEI office, it calls the audience members, many of whom are administrators, calls them to task, calls them in. And the art is able to do that because, as many of my co-panelists have said today, right, that like really pricking at the heart, but also that not always gentle call in, right? Sometimes that more forceful nudge about you need to come to the table and come to the mat and hold yourself accountable. And if not, this art is going to hold you accountable.
Beautifully said. Jasmine, your thought?
Yeah, I love that, and I can't wait to learn more about this Transforming Theater Fellows. I think around this question about civics being a driver of improved health equity and the really tangible skills that artists learn out of necessity of being together. So I think we take terms like ensemble in the space of music for granted, but anyone who's ever played like in a band or sung in a choir or with an orchestra has had to be really intentional about listening to others. Like you can't be a great musician in an ensemble unless you're listening to others. And I would argue that you can't be a great member of a society if you are not actively listening. And that's something that we learn from the arts, and it's one of the gifts that the arts gives us as humans. So thinking about civics as a driver and the broader and growing field of cultural determinants of health, I feel like artists in particular as culture bearers, as some of the only people who can really tell us the truth about ourselves. James Baldwin really went in on that one, that artists are the people that help us see our own truths. That if we're looking at the cultural determinants of health and leaning into the methods for communicating across differences, across different publics, as LaConte just shared, and thinking back to my earlier example of the girls' education and the health implications of that work. There are multiple audiences, there are multiple publics. You had the actual government officials who were working on a policy and were able to glean a bit more nuance from seeing that performance and understanding the intricacies of family dynamics. You had parents who saw that performance and who were held accountable in that moment for their choices to allow their daughters to be in precarious situations in order to fulfill their educational interest. We had students together, young people who weren't even of age to vote. So thinking about civics beyond just who can vote, but civics and activism is what are citizens doing on a citizen level politically. But you had young people who weren't even eligible to vote, thinking about how do I make a difference through this art? How do I shift the way my peers are thinking about health? And they did that through art. So when I think about the participatory nature of art, and not all art is actually participatory in its medium, but many of, like visual art isn't necessarily participatory, but it can be done in ways that are participatory. The participatory nature allows us to be better together, and it is that together that is what can drive the way our society approaches some of the biggest challenges that we face. And this is where I see really important implications for health equity.
Great. So lots of great comments today. I know we're running up towards the end of the hour. We have one more question that anyone on the panel can choose to answer before I move into closing. We have one participant who asked, what kinds of research / public health frameworks are you using in your arts-based work in the community? If anybody has any examples on the panel. Frameworks, research frameworks, or public health frameworks?
I'll chime in. I always elevate Black feminism and Black feminisms with an S as an important framework, a framework that is sometimes, but should more be taught in public health spaces and classrooms, and not be seen as just an elective. So Black feminisms all day.
Not in terms of a framework, but in terms of how we are documenting, as was shared earlier. I think that one important area that is growing is how we're using the tools of implementation science to think about what are the impacts and outcomes of arts-based performance work. So how do we think about pre and post surveys with audiences? How do we think about the ways that, for an example, in mental health, that we are able to cull survey data to then create performance-based work that is rooted in data from research studies, so that our studies have more of a public facing mechanism for accountability, that we don't just write articles for the sake of those in the academy, but that work does go out, and that there's a mechanism for receiving feedback from those performances. So those are the methodological research areas that my work is most interested in.
And quick one thing, Jasmine, before you run, you just mentioned data and measurement. So there was a question in the chat that was saying, I'm very interested in qualitative and quantitative measurements and data being used in art and activism spaces. Can you share some examples or resources in your work?
I will share one quick example.
Yes.
During the Ebola epidemic, the students I worked with in Liberia worked with UNICEF, and they were some of the first people to do awareness work around the epidemic. When I mentioned feedback loops, this is part of where that work comes from. They had the best practices from World Health Organization and from UNICEF. They had all these guides, all these posters, and people were like, they're still not getting the messages. So the students said, okay, how can we perform this so that our communities will understand? They took the data, they took the best practice information, and they performed, like if the guidance was, if you have a sick family member, do not touch them. And the guidance continues, if you have a sick family member, take them to the clinic. In a place where the nearest clinic might be 5 miles away and people do not drive cars, how do you simultaneously not touch your sick family member and get them to the clinic? It sounds great on a radio. It looks great on a poster. It is not possible when you are using your body as an artist to explain this public health guidance. So when the students would go out to perform this, they were getting feedback from audiences such as, the health clinic is XYZ far away. For these reasons, we can't access it. There are no medical professionals in these clinics because people are afraid of getting Ebola, so on and so forth. And obviously it's not possible to not touch people. So then what can we do? They were able to take that feedback from the live performance, and this is that participatory nature again, bring that feedback back to UNICEF, and in discussion meetings with the professionals, the health professionals in that setting, and the communications development professionals were actually able to reshape the guidance that was going out to communities about how to prevent the spread of the virus. So feedback mechanisms, people coming together and contesting, that's important, to be able to contest things that are deemed to be coming from experts and to bring that lived experience into the conversation.
Great example. Thank you. Thank you. Thank you. Packed a lot in a short time. All right. So as we close this webinar, we'd like to hear about your, whether or not this information was practical and applicable to your work. And so we want to invite you to fill out a short survey. You should be able to access it through the link in the chat or by scanning the QR code that you're seeing on the screen. And I wanted to just say thank you to this amazing panel. We packed a lot of great information and examples in a short period of time, and I know that you all have could be a lot of places today. So we appreciate you spending the time with us to have this important conversation. And that goes to the panelists and our entire audience. So please take the time to fill out this survey. We really appreciate it. We we use the feedback for improving future conversations. And we also wanted to say one more thing. We are having another webinar on June 18th. It's called Responding to Mental Health in a Time of Crisis. For more information about our upcoming activities, you can visit our website. You can also follow us on social media to help spread the word by sharing our content and anything that's most interesting to your work. So we look forward to seeing you soon. Thank you all.